Hello, listeners, and welcome back to Everyday Health Stories, the podcast where we explore the fascinating world of medical science through the power of storytelling. Each week, we bring you compelling science and simple strategies that can help you take control of your health one step at a time. If this is your first time joining us, hit pause for a moment and click on follow or subscribe, depending on where you're listening. That way, you'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes, one story at a time. Dr. Reddy, today we're exploring a connection that many people might not be aware of: the profound relationship between heart health and brain function. It turns out that what's good for your heart is also good for your brain, but the connections run much deeper than most of us realize.
That's right. The heart-brain connection is one of the most important health relationships we're learning about, with implications for everything from cognitive decline to mood disorders.
So, Dr. Reddy, how exactly are the heart and brain connected?
The connection works in several ways. Most directly, your heart pumps about 20% of your blood to your brain. Your brain needs a steady flow of oxygen and nutrients to work properly, just like any other organ in your body. But beyond this physical connection, we're discovering that the same things that can hurt your heart can also hurt your brain, and the same treatments that help one often help the other too.
I understand you recently learned about a forum that highlighted some remarkable cases demonstrating this connection.
Yes, I had the opportunity to learn about the proceedings of the Heart Forum at El Camino Health in California, where cardiologists and neurologists came together to discuss the latest research on the heart-brain connection. One case in particular stood out to me, and I'd like to share it with our listeners.
Please do.
It's the case of Margaret, a 72-year-old retired school administrator who had been experiencing increasing memory problems and confusion. Her family was concerned she might be developing Alzheimer's disease, as her mother had suffered from dementia in her later years.
That must have been frightening for both Margaret and her family.
It was. Margaret underwent cognitive testing that confirmed she had mild cognitive impairment. But what's fascinating is what happened next. During a comprehensive evaluation, her doctors discovered she had undiagnosed atrial fibrillation, an irregular heart rhythm that she wasn't even aware of.
So she had a heart condition that was flying under the radar?
Yes. Atrial fibrillation, which is basically when your heart beats irregularly, can come and go, and sometimes people don't even feel it happening. But when your heart isn't beating in a steady rhythm, it can reduce the amount of blood flowing to your brain by up to 30%, even without causing a stroke. In Margaret's case, this reduced blood flow was likely making her memory and thinking problems worse.
What happened when they treated her heart condition?
Her doctors started her on appropriate treatment, including blood thinners to prevent clots and medication to control her heart rhythm. Within 3 months, her family noticed significant improvements in her memory and thinking. After 6 months, her cognitive test scores had improved by nearly 40%.
That's remarkable. So treating her heart condition actually improved her brain function?
Yes, and this is what makes the heart-brain connection so important. In some cases, what appears to be early dementia might actually be related to cardiovascular issues that can be treated. This doesn't mean all cognitive decline is caused by heart problems, but it does highlight how interconnected these systems are.
Are there other heart conditions besides atrial fibrillation that can affect brain function?
Absolutely. High blood pressure is probably the biggest risk factor we can actually control when it comes to memory problems. Over time, high blood pressure damages the tiny blood vessels in your brain, which leads to thinking and memory issues. Heart failure, when your heart can't pump blood effectively, also means less blood gets to your brain. And when you have blocked arteries in your heart, similar blockages often happen in the blood vessels that feed your brain.
I've also heard that heart attacks and other cardiac events can affect cognitive function. Is that true?
Yes, and this is something we're understanding better now. After a heart attack or heart surgery, up to 50% of patients experience some degree of thinking and memory problems. Most people recover, but for some, these changes can last longer. This happens because during heart problems, the brain might not get enough oxygen, tiny blood clots can form, and inflammation throughout the body can affect brain function.
That's a staggering percentage. Are there ways to protect brain function during cardiac events or procedures?
This is an active area of research. Some promising approaches include carefully managing blood pressure during procedures, using special monitors to check how much oxygen the brain is getting, and in some cases, cooling the body temperature to protect the brain. There's also evidence that getting patients moving and doing mental exercises soon after heart problems can help their brain recovery.
Let's talk about shared risk factors between heart and brain disease. What should our listeners be aware of?
The major risk factors that we can actually change affect both your heart and brain: high blood pressure, diabetes, high cholesterol, smoking, not exercising enough, poor eating habits, and being overweight. What's fascinating is that when you address these factors, you're not only protecting your heart, but also protecting your brain. For instance, keeping your blood pressure under control during middle age can reduce your risk of dementia by up to 27%.
Are there any new biomarkers or tests that can help assess both heart and brain health?
Yes, several new blood tests are showing promise. There are proteins in the blood that we've traditionally used to check for heart failure, and we're finding they might also tell us about brain health risks. Tests that measure inflammation in the body can give us insights into both heart and brain health. And new imaging techniques can now show us how well both your heart and brain are working at the same time, giving us a more complete picture.
That's fascinating. Are there specific imaging tools that can give us an even more detailed look at how the heart and brain are functioning?
Absolutely. One of the most exciting developments is the use of PET scans, specifically cardiac PET and brain PET imaging. PET stands for positron emission tomography, and it's a type of imaging that lets us see how organs are functioning, not just what they look like. Cardiac PET is incredibly precise for detecting microvascular disease, which is often missed by standard stress tests. It allows us to measure blood flow in the tiniest vessels of the heart, even when major arteries look normal.
And brain PET works similarly for the brain?
Yes, brain PET scans, especially FDG and amyloid PET, can detect metabolic changes and early signs of cognitive decline, sometimes before symptoms even start. It's a powerful tool for spotting the earliest stages of mild cognitive impairment and even Alzheimer's disease.
That sounds like a real breakthrough, especially for people who may have subtle symptoms that are easy to overlook.
It is. And here's the really exciting news. Our clinic will soon be getting a PET CT scanner, which means we'll be able to offer both cardiac and brain PET studies under one roof. This will help us catch microvascular disease earlier, whether it's affecting the heart, the brain, or both, and intervene before more serious problems develop.
That's amazing. So we're talking about being able to detect the hidden root causes of heart disease and dementia with one integrated scan?
Yes, that's the vision. It's all about early detection and taking action before irreversible damage sets in. The more we can see, the better we can help our patients protect both their heart and mind.
What about medications? Do heart medications affect brain function?
This is an important question. Some heart medications, particularly certain blood pressure drugs, may actually help protect your brain beyond just helping your heart. On the flip side, some medications can occasionally affect your thinking and memory as a side effect, especially in older adults. This is why it's so important to regularly review all your medications with your doctor, especially if you're taking several different drugs.
I'm curious about lifestyle approaches. Is what's good for your heart usually good for your brain too?
Definitely, what's good for your heart is often great for your brain too. For example, the Mediterranean diet isn't just heart-friendly, it's also been linked to better memory and thinking skills. Getting regular exercise helps both by boosting blood flow to your heart and your brain. Sleep plays a big role too. It helps your heart recover and gives your brain time to clear out waste. Even stress management, like mindfulness or meditation, can improve both your heart rate and your focus. It all connects.
So it really is all connected. Taking care of one helps take care of the other.
Exactly. And it goes both ways. Mental health issues like anxiety, depression, or chronic stress can raise your risk of heart disease. That's why more and more we're looking at heart and brain health together, not separately.
Can you share another case that illustrates this connection?
From the forum proceedings, there was a case presented by a neurologist about David, a 58-year-old executive who had experienced what we call a mini stroke, a temporary blockage of blood flow to the brain. During his recovery, his doctors discovered he had sleep apnea, a condition where breathing stops and starts during sleep, that was not only increasing his stroke risk, but also affecting his thinking and memory at work.
How did treating the sleep apnea help him?
After starting CPAP therapy, which is a machine that helps keep his airways open during sleep, David experienced improvements in both his heart health and his thinking abilities. His blood pressure returned to normal, his heart rhythm became more stable, and his memory and decision-making skills improved significantly. His case shows how treating a condition that affects both heart and brain can help both organs at the same time.
These stories are so encouraging. What are the key takeaways for our listeners?
First, recognize that heart and brain health are intimately connected. They're not separate systems. Second, know your cardiovascular risk factors and work with your healthcare provider to address them, not just for heart health, but for brain protection too. Third, if you or a loved one experiences cognitive changes, ensure that cardiovascular health is thoroughly evaluated as part of the assessment.
And for those who want to be proactive?
Focus on the fundamentals: regular physical activity, a Mediterranean-style eating pattern, quality sleep, stress management, and social connection. These approaches benefit both heart and brain health. Also, regular checkups to monitor blood pressure, cholesterol, and blood sugar can catch problems before they affect either organ.
Is there anything on the horizon that you're particularly excited about in this field?
I'm excited about the growing collaboration between heart doctors and brain doctors. We're seeing more heart-brain clinics that look at both organs together when treating patients. There are also promising developments in remote monitoring technologies like wearable devices and smartphone apps that can track both heart and brain health, potentially allowing us to step in earlier when problems start to develop.
Dr. Reddy, this has been a fascinating glimpse into the intricate connection between our hearts and our brains. The idea that protecting one organ system directly benefits the other gives us even more motivation to adopt heart-healthy habits. And the cases you've shared offer hope that addressing cardiovascular issues might help preserve or even improve cognitive function. Thank you for making such a complex topic so accessible.
It's been great talking about this with you and our listeners. We're learning more every day about how deeply the heart and brain are connected, and one thing's clear: they're in this together. So here's what I hope sticks with you. Every time you make a heart-healthy choice, whether it's moving your body, getting good sleep, or managing stress, you're also doing something amazing for your brain. The choices you make today aren't just about now, they're a gift to your future self, both in heart and mind.
And to our listeners, thank you for joining us on Everyday Health Stories. We hope this episode has sparked your curiosity about the profound connection between your heart and your brain. Don't forget to subscribe for more explorations into the cutting edge of health and wellness. If you found this discussion intriguing, please share it with anyone interested in protecting both their cardiovascular and cognitive health.
As always, the information provided in this podcast is for educational purposes only and does not constitute medical advice. Always consult with a qualified healthcare professional before making significant changes to your health regimen or addressing specific health concerns.
Until next time, care for your heart, nourish your brain, and stay curious about the fascinating connections between your body systems. Bye for now.